Prostate cancer is one of the most common types of cancer affecting men worldwide, and understanding its early symptoms can be a lifesaver. Many people underestimate the importance of early detection, but recognizing the warning signs can make a significant difference in outcomes. Let's explore this topic in detail and provide you with all the essential information you need to protect your health or help a loved one. The prostate is a small gland, roughly the size of a walnut, located just below the bladder and in front of the rectum. It plays a crucial role in the male reproductive system by producing seminal fluid, which nourishes and transports sperm. While its size and location might make it seem insignificant, problems with the prostate can have serious consequences for your health. Prostate cancer begins when cells in the prostate gland start to grow uncontrollably. Over time, these cancerous cells can form a tumor, and if left untreated, the cancer can spread to other parts of the body, including the bones, lymph nodes, and other organs. However, if detected early, prostate cancer is highly treatable, which is why knowing the early symptoms is so important. One of the most common early symptoms of prostate cancer is changes in urination. You might notice a frequent need to urinate, especially at night. This symptom, known as nocturia, can disrupt your sleep and significantly impact your quality of life. Some men also experience difficulty starting or stopping urination, a weak or interrupted urine flow, or a feeling that the bladder isn't fully empty after urinating. These symptoms can be subtle at first, so it's easy to dismiss them as a natural part of aging. However, any persistent changes in urinary habits should be discussed with a healthcare provider. Another symptom to watch for is blood in the urine or semen. While it can be alarming to notice blood during urination or ejaculation, it's a sign that should never be ignored. This symptom could indicate prostate cancer or other conditions, such as an infection or an enlarged prostate. Either way, it's crucial to seek medical evaluation to determine the cause. Pain or discomfort in the pelvic area is another potential early sign of prostate cancer. This discomfort might manifest as a dull ache or persistent pain in the lower back, hips, or thighs. Because these areas are close to the prostate gland, cancer can sometimes cause referred pain in nearby regions. While not every ache or pain in these areas indicates prostate cancer, persistent or unexplained discomfort warrants further investigation. Sexual dysfunction can also be an early symptom of prostate cancer. Men might experience difficulty achieving or maintaining an erection, a condition known as erectile dysfunction. While erectile dysfunction is relatively common and can result from various factors, including stress and other health conditions, it can sometimes signal an underlying problem with the prostate. In some cases, prostate cancer can lead to unexplained weight loss or fatigue. While these symptoms are more commonly associated with advanced stages of the disease, they can occasionally appear earlier. If you're experiencing a significant drop in weight or persistent tiredness that doesn't improve with rest, it's essential to consult a doctor. It's also important to understand that early-stage prostate cancer often doesn't cause any noticeable symptoms. That's why regular screenings are crucial, especially for men over the age of 50 or those with risk factors such as a family history of prostate cancer. Screenings typically include a prostate-specific antigen, PSA, blood test, and a digital rectal exam, DRE. While these tests can't confirm the presence of cancer, they can identify potential problems that require further evaluation. Let's talk about the risk factors for prostate cancer so you can understand if you're at higher risk. Age is one of the most significant risk factors. Prostate cancer is rare in men under 40, but the risk increases significantly after age 50. In fact, about 6 in 10 cases are diagnosed in men over 65. Family history also plays a role. If you have a father, brother, or other close relative who has had prostate cancer, your risk is higher. This is particularly true if the relative was diagnosed at a young age, or if there's a history of certain genetic mutations, such as BRCA1 or BRCA2, in your family. Race and ethnicity can also influence your risk. Prostate cancer is more common in African American men than in men of other races. Additionally, African American men are more likely to develop aggressive forms of the disease and are at a higher risk of dying from it. The reasons for these disparities are not entirely understood, but they underscore the importance of regular screenings and early detection in high-risk populations. Diet and lifestyle factors might also contribute to your risk. A diet high in red meat, processed foods, and dairy products and low in fruits and vegetables has been linked to an increased risk of prostate cancer. Maintaining a healthy weight, exercising regularly, and eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help reduce your risk. If you've been diagnosed with prostate cancer or are concerned about your risk, you might be wondering about the treatment options. The good news is that there are several effective treatments available, depending on the stage and aggressiveness of the cancer. In early stages, active surveillance or watchful waiting might be recommended for slow-growing cancers that aren't causing symptoms. This approach involves regular monitoring with PSA tests, DREs, and imaging studies to ensure the cancer isn't progressing. For more aggressive cancers, treatment options include surgery, radiation therapy, hormone therapy, chemotherapy, and newer targeted therapies. Each of these treatments has its own risks and benefits, and the best choice depends on your individual circumstances. Consulting with a team of specialists, including urologists, oncologists, and radiation therapists, can help you make an informed decision about your care. Prostate cancer can be a frightening diagnosis, but it's important to remember that many men live long and healthy lives after being treated. Advances in medical technology and research continue to improve outcomes and quality of life for prostate cancer patients. If you're experiencing any of the symptoms we've discussed or have risk factors for prostate cancer, don't wait to take action. Early detection is your best defense. In addition to seeking medical care, consider making lifestyle changes to support your overall health and reduce your cancer risk. Eating a nutritious diet, staying physically active, managing stress, and avoiding smoking and excessive alcohol consumption can benefit not only your prostate health, but your overall well-being. Education and awareness are powerful tools in the fight against prostate cancer. By learning about the early symptoms, risk factors, and preventive measures, you can take control of your health and encourage others to do the same. Share this information with your friends, family, and community to help spread awareness and potentially save lives. Remember, your health is your most valuable asset. Pay attention to your body, don't ignore warning signs, and prioritize regular checkups with your healthcare provider. Together, we can work toward a future with fewer prostate cancer diagnoses and better outcomes for those affected by this disease. The psychological impact of a prostate cancer diagnosis should not be underestimated. Many men experience anxiety, fear, or even depression upon learning of their condition. This emotional distress often stems from concerns about the future, the potential impact on personal relationships, and uncertainties surrounding treatment outcomes. Additionally, the stigma associated with discussing men's health issues can lead to feelings of isolation or reluctance to seek support. Coping with these challenges requires a multifaceted approach. Open communication with healthcare providers can alleviate fears by providing clear information about the diagnosis and treatment options. Many men find it helpful to join support groups where they can connect with others facing similar challenges. These groups offer a safe space to share experiences, gain emotional support, and learn practical strategies for managing the condition. Therapy or counseling can also play a vital role in addressing the mental health aspects of living with prostate cancer. Speaking with a mental health professional allows patients to process their emotions, develop resilience, and adopt coping mechanisms to navigate the journey ahead. Cognitive behavioral therapy, CBT, for example, is particularly effective in managing anxiety and depression by helping individuals reframe negative thoughts and focus on actionable solutions. For some, mindfulness and relaxation techniques can be invaluable tools. Practices such as meditation, deep breathing, or yoga can help reduce stress and promote emotional balance. Physical activity, even in moderate forms like walking or swimming, is another excellent way to boost mood and overall well-being. Exercise releases endorphins, which are natural mood elevators, and contributes to better physical health, which in turn supports recovery. Family and friends also play a critical role in a patient's emotional well-being. Encouraging open dialogue about feelings and concerns can strengthen these bonds and ensure that the patient feels supported throughout their journey. Caregivers should be mindful of their own needs too, as supporting a loved one with cancer can be emotionally taxing. Finally, addressing psychological well-being is not just about managing stress and emotions. It can also positively impact treatment outcomes. Studies have shown that patients with strong mental and emotional health are more likely to adhere to treatment plans, maintain better physical health, and experience improved quality of life. By prioritizing mental health alongside physical treatment, patients can take a comprehensive approach to their recovery journey.